Schizotypical personality disorder. Well, before knowing the schizotypical personality disorder, we first need to know that what is personality disorder. Personality disorder is a mental health condition that involve long-lasting, all-encompassing disruptive patterns of thinking, behavior, mood, and relating to others. These patterns cause a person significant distress or impair their ability to function. There are 10 types of personality disorder. The DSM 5, which is the standard reference publication for recognized mental illness, organizes the 10 types of personality disorder into three main clusters. Each cluster have a different symptoms in common. Cluster A, Cluster B, and Cluster C. Schizotypical belongs to Cluster A, which includes odd and eccentric behaviors. People with schizotypical personality disorders are often described as odd and eccentric and usually have few, if any, close relationships. They generally don't understand that how relationships form or the impact of their behavior on others. They may also misinterpret others' motivation and behavior and develop the significant distrust of others. These problems may lead to severe anxiety and a tendency to avoid social situations, as the person with schizotypical personality disorder tends to hold peculiar beliefs and may have difficulty with responding appropriately to social cues. Schizotypical personality disorder typically is diagnosed in early adulthood and is likely to endure across the lifespan, though treatments such as medication and therapy can improve the symptoms. Your risk of schizotypical personality disorder may be greater if you have a relative who have schizophrenia or another psychotic disorder. There is a huge difference between schizophrenia and psychotypical, but they share some of the symptoms together. Let's check out what are the symptoms of schizotypical personality disorder. Being a loner and lacking the close friends outside of the immediate family, flat emotions or limited emotions or inappropriate emotional responses when there is a need, persistent and excessive social anxiety when encounter any social situation, incorrect interpretation of events such as feeling that something that is actually harmless or inoffensive has a direct personal meaning. They have odd, eccentric, and unusual thinking, beliefs, or mannerism. They're surrounded and occupied by suspicious or paranoid thoughts and consistent doubts about the loyalty of the others. That's why they are not able to make close friends. Beliefs in special powers like telepathy or superstitions. Unusual perceptions such as sensing an absence of person's presence or having illusions that other people think as inappropriate. Dressing in a peculiar way, such as appearing unkempt or wearing oddly matched clothes. Peculiar style of speech, such as vague or unusual patterns of speaking or rambling oddly during the conversation with someone else. Well, there are so many complications that comes with the schizotypical personality disorder, which includes anxiety, depression, schizophrenia, drug abuse, suicidal attempts, social relationship issues, psychotic episodes, and social problems at work, at home, and with others. If